So I will be presenting on breast cancer. A couple of things that can increase the incidence of breast cancer are age, gender, your personal history, histologic risk factors, genetic risk factors, reproductive risk factors, and exogenous hormone use. So with age, the incidence of breast cancer increases with age in female population. It is more prevalent in females versus males. A personal history with breast cancer. So if you've had breast cancer in one breast, it is more likely that you'll get it in the other one as well. Histological abnormalities in breast biopsies are important breast cancer risk factors. These include lobular carcinoma in situ and proliferative changes with atypia. It is genetic. So first degree relatives of cancer patients have a 2 to 3 times more of a risk of developing breast cancer. 5 to 10% of breast cancer cases are due to genetic factors. There's a BRCA gene, and these are the most important genes responsible for increased chance of getting breast cancer. Reproductive milestones that increase the woman's lifetime estrogen exposure are said to increase risk, such as getting like your period before the age of 12, your first birth after the age of 30, and menopause after the age of 55. Estrogen and progesterone are taken for contraception and hormone replacement therapy in postmenopausal women, and this may increase the risk as well. So research has shown that combining AI systems for short and long-term breast cancer results in an improved cancer risk assessment. Diagnostic AI models are trained to detect suspicious lesions on mammograms and are reliable at estimating short-term breast cancer risk. Texture AI models are capable of identifying breast density, and these are more suitable for long-term cancer risks. Women with dense breast tissue, have a higher risk of developing breast cancer. So some AI methods that are used are computation radiology, and this is radiology that is used to carry out procedures done by experts, computer vision, lesion detection, or recognition of patterns for lesion detection. There's deep learning, where they process images by a multi-neural layer or network, and radiomics, where it extracts quantitative aspects from an image. Invasive breast cancer affects 1 in 8 women in the United States and about 1 in 1,000 men in their lifetime. In 2008, there was an estimated 1.38 million new cases of invasive breast cancer globally. In Eastern Africa, there's about 19.3 cases per 100,000 people. Western Europe, 89.9 cases per 100,000. The incident rates do increase with age. So from 20 to 24 years old, you'll have about 1.5 cases per 100,000 women. 75 to 79 years old, it goes way up higher, 421.3 cases per 100,000. Death rates have been decreasing over the past 25 years in North America and Europe with early detection and advancements in treatment, but death rates are still rising in African and Asian countries. The incident, as I mentioned, the incident rate does increase as you get much older. Breast cancer rates among women in different racial and ethnic groups, according to the American Cancer Society, non-Hispanic white tends to be more prevalent in that ethnic group. African Americans are a little bit below that with 124 cases in 100,000. Hispanics have about 91 in 100,000. American Indian and Alaska Native are around the same with 91.9, and Asian American Pacific Islander have the lowest rates. So to understand the way breast cancer spread, it is beneficial to understand the anatomy of breasts. Women have more breast tissue than men, are made of different components. So each breast has about 15 to 20 lobes, and each lobe has smaller sacs called lobules, which are milk glands. The lobes and lobules are connected to the nipple by ducts. Milk comes out of the nipple during breastfeeding. The lymph nodes are part of the lymphatic system, which are an important part of the immune system that protects the body from disease and infection. Because lymph vessels carry lymph away from the breast, cancer cells can enter the lymph vessels and grow into the lymph nodes and spread throughout the body. There are different types of breast cancer, and they are usually named after the area where it starts. Invasive ductal carcinoma starts in the ducts and accounts for about 80% of breast cancer. Invasive lobular carcinoma starts in the lobules and accounts for about 10%. Inflammatory breast cancer is another less common type of breast cancer. It can spread throughout different ways through like your tissue, lymphatic system, and blood. So from the tissue, if it starts in this tissue, it'll just spread from the original site into nearby areas. Through the lymphatic system, the cancer cells get into like the nearby vessels and travel to other parts of the body. And through the blood, it's the same way, but it travels through the blood, not the lymphatic system. Breast cancer can develop due to DNA damage and genetic mutations that can be caused by exposure to estrogen. The BRCA genes can also be inherited and increase the risk of developing breast cancers. Breast cancer can be invasive or non-invasive. Non-invasive neoplasms are separated into two categories. So lobular carcinoma in situ and ductal carcinoma in situ. LCIS presents as a conformity to the outline of the normal lobule. I think I have a picture here. And then DCIS presents as discrete spaces filled with malignant cells. It can lead to invasive cancer if not treated. Invasive ductal cancer appears as a discrete abnormalities in mammograms and can usually be palpated as a lump. Because it tends to be permeated the breast in a single, because it permeates the breast in a single file nature, it often escapes detection on a mammogram until it's pretty extensive. Invasive lobular carcinoma accounts for about 10% and is more easily recognized. So typically in the early stages of cancer, there are no symptoms. Once the cancer has increased in size, it is possible that you can feel a lump on your breast. Breast pain is not usually a symptom, but it does happen about 5% of the time. Advanced diseases can present with peau d'orange, I don't know how to pronounce that, sorry. But it basically kind of just means where your breast appears like the skin of an orange. Frank ulcerations, fixation to the chest wall. Inflammatory breast cancer resembles a breast abscess, so you'll see like swelling, redness, local inflammation. And Piaget disease can present with nipple changes. So to diagnose, it usually requires about like 3 different methods: clinical evaluation, imaging, and tissue biopsy. A mammogram is usually the most common method for diagnosis. Most asymptomatic symptoms are found during a screening. However, mammograms are not sensitive enough for younger women, in which case ultrasonography can be used. Ultrasonography is useful in assessing the consistency and size of breast lumps. MRI is efficient for describing abnormalities in soft tissues. It can detect if there are occult lesions. Tissue biopsy is an important step in evaluation. AI models for diagnoses are still being tested, but research has shown that the AI models are just as good, if not better, than radiologists at detecting abnormalities. Additional trials do need to be done in order for them to be implemented. And results need to show that these methods can not only accurately detect cancer, but that it can do so different ethnicities and ages. Ways to treat. Treatments are focused at reducing the chance of local recurrence and the risk of metastasis. So surgery is common. It's important for local control of the disease. It removes the affected breast and axillary lymph nodes. A mastectomy can effectively remove the localized cancer. With radiation, the risk of cancer reoccurrence goes down by about 50% at 10 years, and the risk of death goes down by about 20 at 15 years. It is beneficial for large tumors and can be used in palliative therapy in advanced cases. Chemo, you can use like medical treatment, where they do chemo. There's some systematic therapies to help manage breast cancer, and that's with chemo, hormone therapy, and targeted therapy. A chemo regimen can reduce the risk of relapse by about 25% over a 10-year period. Side effects range in like infection, pain, and bleeding. With surgery, with chemo, it's common to get like nausea, vomiting, hair loss, memory loss, fertility issues, neuropathy. With hormone treatment, hot flashes, fatigue, nausea, and impotence in males. And with radiation therapy, you can get pain and skin changes, fatigue, hair loss, nausea, heart and lung issues, and neuropathy. And that is it.